Hi guys. So, a lot of people are now wondering, do I have Alzheimer's or will I ever get Alzheimer's? And there is absolutely new technology now available that can, with a really high degree of accuracy, tell you if you in fact have a high risk of developing Alzheimer's or if you currently may in fact be suffering from it. Most of us are probably in a category of, will I ever get it because I have a parent or a sibling, or I'm just really worried that I might have Alzheimer's. Well, the truth is that you can actually ask your doctor for these blood tests that are now available. Of course, many of us, including us neurologists, are very guarded regarding these available blood tests because they may have lots of implications that need a lot of discussion. For example, there may be false positives where a test may show you that you are at risk, but in fact, you are at very little risk. So, but this is the case with any blood tests. Any blood test, any test that you have should be placed into context and not taken as the only test that will identify a particular disorder. But back to Alzheimer's. So we now have the availability of blood tests, not necessarily spinal taps, although those can be done too. But you can go to any local laboratory, and Quest offers this, LabCorp offers this, and request an Alzheimer's risk stratification test. And what these include is a test of the ratio of beta amyloid and phosphorylated tau, which have been shown to be helpful in detection of Alzheimer's. There's also genetic tests, including the ApoE genetic profile, which can determine if you're at a higher risk for developing Alzheimer's. But all of this, again, needs to be placed in the context. You really need to have a full comprehensive evaluation by your doctors, preferably a neurologist, and it must be placed into the context of your age, what exactly your symptoms are, because many of us have memory loss, but it may not actually be the type that you see with dementia, MRI or other imaging findings, and the progression, the course of your symptoms. Is it getting worse and worse? Family history, all that needs to be placed in the context. Of course, here at my office, we use additional technology, including specialized electroencephalography or EEG, which can be super helpful. But this has come up even within my own family members now are thinking, do I have Alzheimer's? And it can be scary for a lot of people. Will I get Alzheimer's? So there are blood tests that you can request, but they must really be placed into context. And there's a this is a big topic of conversations among us professionals because a lot of patients are now just, getting these tests done and are becoming really anxious and having panic attacks. Whereas had they placed it in context, it would not have been so. So I think this was super interesting and, close to home, even in my own personal family life, there's these discussions and I thought you should know. Please do not hesitate to call us or send us a message. And you can reach us via phone, of course, 949-652-7301, or reach us via email, info@neurospalbrain.com, and let us know if we can be of any help. Thank you so much.